Should I get a POLST for my end-of-life care? Thinking about end-of-life care can feel overwhelming, but understanding your options can make a big difference. If your loved one has a serious illness, like cancer, it's important to know what choices are available. One of those options is a POLST form, which stands for Physician Orders for Life-Sustaining Treatment. It's a medical document that helps communicate specific treatment wishes to healthcare providers. This form is usually 1 or 2 pages long and travels with your loved one across different care settings. Whether they are at home, in a hospital, or in an ambulance, the form ensures everyone understands what kind of care they want or do not want. And like a general advance directive, which covers broad wishes, a POLST gives clear instructions about treatments like cardiopulmonary resuscitation, ventilators, or artificial nutrition. It offers choices along a spectrum, from comfort care to full treatment, so your loved one's preferences are clearly outlined. A POLST is mainly for people with serious illnesses or advanced frailty, especially if their healthcare team believes they might pass away within a year. Signs that a POLST might be helpful include frequent hospital visits, declining physical function, or weight loss. The median time from completing a POLST to passing away is about 6 weeks, with most forms filled out in the last 2 months of life. Having a POLST can help ensure your loved one's wishes are followed during emergencies, reducing confusion and unnecessary treatments. It also spares families from making difficult decisions in stressful moments. Many people with POLST forms are less likely to receive unwanted life-sustaining treatments, which can cause suffering without benefit. The process involves talking with your loved one's healthcare provider about their current health, goals, and values. This conversation is voluntary and based on shared decision-making. Both your loved one and the provider must sign the form, which then becomes part of their medical record. Remember, a POLST is not a one-time decision. It needs to be reviewed and updated if health or wishes change. Availability of these forms varies by state, and some places call it by different names like medical orders for life-sustaining treatment. It's a good idea to ask your healthcare team if this option is available in your area. Deciding whether to get a POLST depends on your loved one's health, their values, and what kind of care they want at the end of life. Having this document can bring peace of mind, knowing their wishes are clear and will be respected by all healthcare providers, no matter where they are. It's a helpful tool in end-of-life planning and healthcare navigation, making sure your loved one's preferences are honored when it matters most.